Hi, my name is Morgan Lewis, and my partner who will appear in the video later is Theresa, and today we will be presenting our injury, which is hip femoral acetabulum impingement with a labral tear. Our patient is Jason King. He is a 22-year-old male athlete who plays on the men's basketball team here at Texas State University. One day he was in practice and all of a sudden he experienced an intense pain in his hip. He was twisting and pivoting on his way to get a ball during a fast break. This pain is affecting his training and his everyday life, and that really is worrying him that because of this intense pain, he's not going to be able to get back to for his senior season. Jason is having trouble with extensive hip movement, sitting in a chair, putting on and off his shoes, and getting in and out of his car. He is also experiencing painful clicking, locking, and giving away at the hip. Our clinical findings are that he has reduced medial rotation of the hip and pain with combined flexion and medial rotation.
Hi, I'm Theresa, and I'm going to be talking about the description of our injury today. We have femoral acetabular impingement, which is basically when the femoral head does not fit correctly into the acetabulum. So just imagine like you have a perfectly round ball and it's fitting in like a semicircle cup. It's going to slide and it's going to groove very smoothly. Now this is basically whenever the femoral head is more like an egg shape, and so every time you try to move it, it's going to keep bumping into the sides of the circle in a way. So our labrum is a covering around your acetabulum. That is a tough band that provides like joint congruity and like it basically lubricates the joint itself. So it also does a really important role in keeping the like proprioception. So like knowing where your joint is and like your ability to move properly and fluidly. Because the labrum is so important, we're going to probably get the arthroscopic surgery to repair the labrum. Okay, just like I was talking about earlier, this is a picture of like the femoral head and then the acetabulum, and this right here is the articular cartilage, which is in a way like where the labrum itself sits, which is right. And then this is just a picture explaining the impingement part, showing like where exactly, because it's pushing like towards the front part of the hip, it's gonna cause a tear in the labral right there.
Concerns and precautions for Jason. The labrum plays a huge role in proprioception as well as it distributes synovial fluid throughout the joint. So along with those two things, it also plays a huge role in functional stability. So damage to the labrum long term is it can impair the patient's ability to sense their leg in space and as well as joint movement fluidity. So those are some of the reasons that we chose to go with arthroscopic surgery, is because damage to the labrum could really affect him long term. Another thing too is that if excessive stress is put on his hip after surgery, it can impose a fracture risk. So we really just want to avoid weight bearing, flexion, abduction, and lateral rotation throughout the first 3 to 6 weeks of his rehab.
Okay, so I'm going to talk about the difference between operative and non-operative. So basically the fact that he's an elite athlete is a huge deal because you want your athletes to get back as fast as possible so that way they can continue to practice and play in their sports. Another thing is age. If the patient was older, say, then they're not going to recover as quickly, so surgery could actually be non-beneficial for them. So like it could hurt them and make them worse. So like Morgan said earlier, the hip, because the labrum is such an important role in the hip itself, we want to try to repair that as easily and like less painful as we can. So the rehab protocol for operative versus non-operative is very different. So basically, whenever someone is non-operative, our goal is to increase the muscles around, as well as basically retrain their body how to sit properly, stand properly, move properly. So it's more correcting the gait patterns and their actual physical structure rather than the inside. Rehab for surgical is different because you're actually going in and physically fixing the labrum itself instead of giving it the time to repair itself. So yes, you're still going to do the same things that you did before, but you're going to focus more in the beginning on the simple things like making sure the surgical site is correctly healing, making sure the range of motion is being properly restored. Okay, so during our stage 1, it's going to be from weeks 0 to 2. During our first week, our goal is to basically get the patient to decrease their pain from a 7 out of 10 to a 3 out of 10. For week 2, our goal is going to be to increase isometric exercises for hip adductors and extensors. So some precautions during this phase is to make sure that they don't bring their hip further than 90 degrees or any kind of extension and only 25 degrees of abduction during this time. The way that we plan on getting our goals is work on range of motion exercises with the CPM machine, having them perform exercises like stretching and towel slides, just kind of work on their range of motion and movement. So I'm going to be demonstrating the piriformis stretch, which we're going to have the patient seated because during this time they're supposed to be non-weight bearing or toes touch bearing. So basically the patient's going to make a figure 4 with their leg and make sure that they are keeping their core tight and having an upright posture because we don't want to be leaning down too much because that could put a lot of stress on the back side of their hip. So they're going to have them gently take their knee and push it down until they feel a good stretch and then hold it for anywhere from 30 seconds to 2 minutes.
So for phase 2 for Jason, it's going to be from weeks 2 to 6, and our main goals are to reduce his edema, pain, and spasm, and also we're trying to increase his range of motion in all 6 directions. Some precautions to look at during this second phase is just to make sure that we're avoiding hip pain with exercises. And to increase his range of motion during this rehab stage, we're going to do exercises that'll stretch his hamstrings. We're going to do full passive range of motion exercises, clams, and we're also going to send Jason home with the home exercise program, which will keep his range of motion gains up to date. So for the clams exercise is what I'm going to be demonstrating. We're going to have Jason side-lying, and then we're going to have him just lift his knee up towards the ceiling. That's what we'll instruct him to do. And he can also do other motions such as lifting the back foot towards the ceiling, or even raising both his knee and his foot and raising that towards the ceiling. That'll get both medial rotation, those abductors, and those adductors. So for phase 3, it's going to be weeks 6 through 12, and our goals are to make sure that he's full weight bearing by the end of week 8, and to also make sure that his injured side is 85% of his uninjured side. During this phase 3, we're going to introduce the strength exercises, his proprioception, and also a little bit of agility. So while we're doing these exercises, we really want to make sure that to avoid 90 degrees of hip flexion with resistant exercises. So some of these exercises that we'll be performing are wall squats, mini squats, hill raises, and planks. So I'm going to be demonstrating a plank. We're going to have Jason start out on all fours on his forearms, and then what I'm going to ask him to do is to keep scooting out and then raise his knees off the ground. We're really going to focus on keeping that core tight, not having that back sink in, or also not doing a pike in the air. Just a nice, easy, straight line, and then make sure we're going to do this for at least 30 seconds.
Stage 4 is going to be weeks 12 to 32. Our goal by the end of 26 weeks is to have the patient full weight bearing, and then by the end of the 32 weeks, the patient will be able to return to play. The way that we plan on doing this is working on plyometrics, functional exercises, and sport-specific exercises, things like squat jumps or vertical jumps. I'm going to be demonstrating squat to jumps plyometrics. So basically the important thing during this exercise is the patient keeps their feet hip width apart, and they're going to perform a squat, making sure that their knees don't come above their toes. Then they're going to explode up like they're doing a rebound and then land back down in the same position.
After releasing Jason, he is doing great in basketball. He is made it to the playoffs, and Theresa and I now have season tickets to all of his games.